director of LASIS, and I have a great pleasure today to welcome you to the lecture by Jean Wilbert, focused on COVID in Brazil. And this is yet one more lecture in our series of LASIS Lunchtime lecture series. Very particular one, though. It was happening on the 3rd of November. So I was just joking before I started this introduction that we waited for minutes to start to make sure that everybody voted before they joined us. If you didn't manage to do it before the lecture, please do it afterwards. And now I'll introduce Jean. Jean holds degrees in law, specializing in fundamental rights. And he just recently served as a judge in Brazil. He's especially interested in legal and economic politics, and that facilitates social mobility. He's currently pursuing in La Follette School of Public Affairs with a focus on Latin America. And he's also a member, a part of the think tank that is our LASIS graduate seminar 982, from which many of us know him. And I think from how I got to know Jean, I think of him as one of the thinkers that we so much need in the world, able to think not only through what he is most familiar with, meaning law, but also through a number of other disciplines and fields such as economics. And as you will see, this lecture already looked at some of the slides, philosophy, social sciences, to be able to focus on how to improve the issues which make everyday life of people better or worse. So without taking further time, I would like to welcome Jean and welcome all of you to the lecture on COVID in Brazil today. Thank you.
First of all, Professor Kata, thank you very much, Alberto, not just for this discussion, this great opportunity for me to present the case of Brazil, but also for the opportunity to come to Madison and to study at the University of Wisconsin. I'm so proud and happy to be here, and it's a great opportunity for me to be part of LASIS. I'm so happy. This is one lifetime opportunity. And of course, that being said, today, I would like to show you some reasoning and try to show you some humble ideas about the political and institutional reciprocal effects. I mean by that why institutions, political institutions matter, and how Brazil is experiencing an institutional and political rupture amidst the coronavirus crisis. This is the point. This will be my talk today. I hope to try to explain a little why COVID is so important in a political and institutional sense. So before we can dive into the political and especially into the COVID points, I would like to present you these ideas, these old ideas, long time ago, before the Common Era. Polybius asked himself, wondered, how did Rome become so great? How were they so successful administrating that huge empire? And he reached the conclusion that the answer lies in the virtues, in the peculiar political institutions. So the political institutions are critical to Rome become what they became. And of course, this is not something new. In fact, institutions as a concept are not something new. Machiavelli in the 16th century noticed that bad institutions can really harm the republic. He noticed that vicious institutions can impede the progress and in fact can threaten a nation very surviving. So this is very important. More recently, in our days, Professor Darren Acemoglu from MIT, James Robson, they asked why nations fail. And the answer, of course, institutions. Professor Daniel Roderick from Harvard says that institutions are the road to progress or the road to doom. And of course, we are not talking just in economic development here. We are talking about justice, institutional justice. We can discuss in John Rawls' framework. Appropriate political and legal institutions are critical for any kind of distributive process of social justice. So they are very important. And if they are so important, how can we have good institutions? Douglas North, Nobel Prize 1993, tried to answer this question. He says, we need to build these institutions. How? Politics. Throughout history, institutions have been devised by human beings to create order. This is a key word here. And of course, to reduce uncertainty. So now we find this link between institutions and politics. Politics is nothing more, in fact, is precisely the set of activities that are associated with making decisions. That is how we choose our institutions. And then we can ask ourselves, I think I lost my slides here. Then we can ask ourselves, why do we need politics? Why we need politics? Oh my goodness. Again, without my slides. Here. I think now you are seeing why we need politics. And Professor Howard Schweber, here, a professor at University of Wisconsin, Department of Political Science, he says that nothing is worse than chaos. This is the question for politics. This is why we need politics, because we want to avoid chaos. This is the reason for everything in politics, like the basis of politics is because of that, for this answer, that by art, by our consent, we create that great Leviathan, that state, commonwealth, as Thomas Hobbes would say. So it's just because we want to avoid chaos. We want to create order among our existence between men. And so this is the way. But how about when? How about when, in fact, the politics, the political scenario is the source of chaos? This is the question. For example, in Brazil, Brazil was struggling institutionally and politically before the coronavirus. And of course, after coronavirus, things got much worse. Coronavirus is testing Brazilians' politics and institutions. And of course, Brazilians' institutions should be ready for the challenge. They should be able to coordinate, to bring unity, efficiency in the fight against the virus. And of course, if we ask if they were ready, we can show this through this picture. This improvised graveyard illustrates how Brazil was ready or not for this disease. And we can try to show this through numbers as well, because figures never lie. Well, sometimes they do, but not in this case. And with 5.41 million cases, I think we can really state that Brazil was not ready. And now the questions are, what is the cause of this striking number, 5.4 million? And what are the effects of this number? More precisely, if are there any causes, like political and institutional causes for this number, and especially now, what will be the effect of this huge number, especially political and, of course, institutional effects, because we just noticed that these two frameworks are intrinsically connected. And so the next point is, like, we can try to build this first connection. One way to see this connection between politics and coronavirus is by looking at the association between the confidence in the national government and the cases of coronavirus. As you can easily see, there is a downward trend here, this line going down, and Brazil is like in the left extreme of this graph. What means that we have in Brazil low degree of trust in government and a high number of cases. And of course, when we notice Netherlands, Denmark, Norway. We will see in the other side of the graph, in the opposite side, a high degree of national confidence in the government and is a low number of cases, considering of course the population, cases per million of population. And it's interesting here is that in fact this line is responsible for 20% of the explanation about the number of cases. So the confidence in national government, the government can explain, can be considered responsible by 20% of the number of cases. This is too much. It shows that the more people distrust the government, the higher it's the number of cases, or possibly higher will be the number of cases. So we find here the link between governments and coronavirus cases, and especially how politics impact our real life. And of course, considering that, maybe we can just blame Bolsonaro and we can blame Trump for the same, exactly the same reason. That would be fair. Yeah, absolutely. We can blame them. That would be right. But the point is that that will not explain the big picture. We need to see here that we have politics and we have institutions and vice and versa. And these guys, Bolsonaro and Trump, are just part of this huge problem, especially in Brazil and some degree maybe in the United States. As I had mentioned before, we have here these reciprocal cause and effects, and we can understand them as a two-way road between politics and institutions. And this will help us to understand how coronavirus could hit Brazil and the United States so hard. Because we have institutions, and institutions became cause for new effects. Among these effects, we can find politicians as Bolsonaro and Trump, and then these guys will be the cause for new effects, and these new effects will shape and reshape institutions, create new institutions, and change the current institutions. And so the wheel will start again. And then we can find, through this wheel, the reason for the numbers we just saw. So yes, we can blame Bolsonaro, but Bolsonaro is as much as us as he is an effect of this political will. He is a kind of symptom, not exactly the disease, properly speaking. So of course, we can and should treat the symptoms, for example, the fever, but you should try to investigate the causes. Is it the flu? Is it an infection? Because of course the fever can kill you, obviously, but if you don't understand the cause of this fever, you will not be able to understand why are you having fever, and probably you will not be able to prevent new diseases, and probably you will not understand what is really happening. So blame Bolsonaro is a good starting point, but it's not the end. We need to understand beyond this political idea, seeing this big wheel. Because, for example, Bolsonaro is absolutely the responsible for this tragic picture, the chaos inside the Minister of Health. Amidst this pandemic, we had nothing less than three ministers of health: Mandetta, Tech, and after this general that is the current Minister of Health. So this is just chaos inside our institutional framework. But this is just the tip of the iceberg, because we can find a true institutional war in Brazil. The president against his own ministers, yes, but the president against the Congress, governors against governors, governors against Bolsonaro, against the president, governors and Bolsonaro against the Supreme Court, or trying to find allies in this war, is just an institutional war. In fact, we can see since March, at least, Bolsonaro and the Congress have been at war. We have now in Brazil an unusually assertive Congress. And what has led some to see this strain in the legislature as harmful to governance. Why? Well, some people say that this is preventing unity, that by ignoring bills proposed by the president, in fact, the Congress is allowing Bolsonaro to try to rule the country through executive orders and provisional measures. And other people, exactly the opposite, that the Congress needed to do something because as the executive branch was not doing the right thing, or at least was not doing enough, so somebody needs to do something and needed to do something, and the Congress did. So, and besides that, these more assertive actions, this assertive attitude is an important element of the system of checks and balances. Considering that Bolsonaro is like not acting, maybe not acting as he should, some people have been proposed this semi-parliamentarism or a kind of presidentialism of coalition. It's strange this because we can ask if it wise to change the political arrangement amidst this crisis, and what exactly means this coalition. It sounds like I will scratch your back and you will scratch mine, something that is strange. But the point here is that yes, as an effect of coronavirus, we have this stronger legislative in Brazil right now, and of course, maybe we should have unity. This is part of the government coordination, but absolutely we don't have. In fact, the COVID caused, or we better say that it has exposed the rupture of Brazilian institutions. This is the point, rupture. And then we can evaluate this rupture by analyzing the role of the judiciary in this rupture. Professor Baumgartner and Jones, they explain that in a system of governance, especially in pluralistic systems, the losers, they have opportunity to try to search for more favorable Venus elsewhere, and when they are defeated. And these results in the continual creation of destruction and creation of limited participation. This is exactly what is happening in Brazil, but not in a good sense, because once any congressman lose a battle in the Congress, he will try to get around the 530 deputies and the 81 senators and try to convince 6 out of 11 justices of the Supreme Court. So, in fact, now the judiciary became a new political road and a political alternative. In fact, the judiciary should protect our institutions. For example, should protect the separation of powers. This seems to be something obvious, but in Brazil, this does not happen. In fact, when politics enters the judiciary, it becomes part of the problem, and the Brazilian Supreme Court became a political alternative role. The House of Justice is becoming the House of Politics as well. And I can show you this through numbers. I know that here in Wisconsin, the Supreme Court had to rule the question about like the lockdowns. But in Brazil, we have this flood, 7 months, March to September, almost 6,000 lawsuits, 6,000 cases discussing things related to coronavirus. Just in the Brazilian Supreme Court, it seems like an absolutely striking number. And it is. Obviously, most part of these lawsuits were habeas corpus, trying to release prisoners amidst this crisis. But we have here serious discussions about lockdowns, close or not to close cities and states. And in fact, we have nothing less than 100 actions questioning directly the constitutionality of measures to fight coronavirus or trying to impose some measures to governments, to local governments, or even the federal government. And just the Supreme Court ruled 137 until September, 137 decisions. Is obviously the politicization of the justice system. We can find some illustrative cases here. The conversion of my slides was not good, but I think you can read. We have a complex case, but this complex case show how the Brazilian framework is complex. We will not find answers just evaluating Bolsonaro actions. It's much more complex than that. For example, the Supreme Court decided that, of course, Brazilian federalism is based on comparison. So after recognize, acknowledge that the Supreme Court ruled that we have here a concurrent competence. And by that, we mean that the local powers are entitled to take restrictive measures, restricting mobility, setting here isolation, quarantine, and restricting the circulation of goods and services. This seems to be a very good decision because local powers are like better to decide this kind of thing. But this is strange because this precedent seems to have overruled a long-lasting jurisprudence trend that used to concentrate powers in the hands of a strong central government in the name of coordination. And if you like game theory in economics, we will remember coordination games. And in fact, some people believe that this decision create an institutional anarchy. Now the states are entitled to make their own decisions and in fact to, in some cases, go against the federal plan. So it's impossible to have any kind of comprehensive plan when you have this institutional anarchy. And by deciding that, some states will close, some states will open, and this lack of coordination will lead to a problem both in health and in economic area. So in fact, this lack of coordination harms both the economy and the public health. Besides that, this institutional anarchy leads each power to acting individually. And they are independent, but they should try to act in harmony. And this is obviously not happen. This is just one more face of this political disruptor and this anarchy of the system where Brazilian political institutions are not being ready for what was coming and not now what we are facing related to coronavirus. And we can try to compare Brazil and United States. For example, John Kindle, he says that in the US, in the United States, the founders deliberately designed a constitutional system to be fragmented and incapable of being dominated by one actor. And they succeeded. They call this a sticky government, a government that is resistant to change. Maybe Brazil is in the exactly opposite side. We have nothing less than 7, maybe 8 constitutions. 1824 independence, 1891 republic, then revolution 1934, 1937, redemocratization 1946, military coup 1967, and then the democratization 1988. And in 1969 we had a huge amendment of the constitution. Some believe that was in fact a new constitution. And after this 7 or 8 constitution, both candidates in 2018 elections, they said that we needed a drastic reform in our constitution. So considering this chaos, let's say, yes, Mike, the coup was in 64, but the constitution was 67, 3 years after, because it took some time, like our republic was in 1989, and then just 2 years after we have the constitution. And so, we always have this gap to have a new constitution, sometime to elaborate the constitution, in fact. About equilibrium. So if the point is Brazil is in the other side, how can we find this equilibrium? Exactly. Some people in Brazil believe that we have abandoned constitution, and now the political and institutional decisions are like merely personal convictions. How can we return to order, that political order that was promised by the theorists? Well, we need to have some kind of institutional equilibrium. Maybe we cannot have a government that's too open to change, but it must not be too open too close to change as well. In fact, we need to find some kind of balance when where institutions are flexible to change, but solid to deal with problems and to provide us previsibility, provide us coordination, provide us the possibility to fight this difícil coronavirus.
Vai dormir, o correto é você dormir, Paty. Brinco com ele um pouco.
Tá, tem que pegar o que a gente tá faltando.
And what we have in Brazil.
Vamos pegar comigo? Vamos lá?
Accelerating.
Posso jogar essas caixas, filho?
Open. Let me pull up.
Deixa eu pôr aqui, ó.
I cannot close this microphone. Yes, closed. So we have in Brazil this political will. In fact, before coronavirus, yes, this wheel was turning fast, but after coronavirus, this wheel is turning wild. And if Brazil is to deal with the challenges of today and tomorrow, we need to focus on our institutions. We need to see politicians as part of this problem, and that we need to solve this problem in an institutional and political way. This is, in my point of view, the only way to deal with the causes that led us to the terrible picture that we are today. Incompetence of politicians, especially the ones that are in important positions, lack of public spirit, of republicanism, lack of coordination, each power acting separately by itself, factions, lack of real commitment to the institutions, to the constitution, to the principle of separations of powers. And of course, coronavirus make this wheel turn faster. And the only way to return is to find some way to equilibrate these powers and to have attention to our political and institutional framework. This way, I stop here, and of course, eager to see your questions about what is happening in Brazil, our political and institutional framework. Professor Kata, if you want to regulate, mediate, I'm absolutely, but I can pass. I think Mike, please go ahead.
Mike, please just speak up your question.
Oh, I might have been muted. Yeah, my question is a statistic that has always made me curious. The U.S. seems to be maintaining a gap that continues to widen between the number of corona deaths in the U.S. versus the number in Brazil. I think the gap is now 71,000, and it's increasing. Why has Brazil been so much better able to contain the number of deaths, particularly given the criticisms that are always made of both the Trump government and the Bolsonaro government? Thanks.
Oh, Mike, this is a very interesting question. We have several hypotheses. And of course, one of the possibilities is the age of population, and another possibility is comorbidities. So in the United States, we have maybe, in Brazil, we used to be like proud that we have a health population. And so this can be an explanation. We have streams of the virus that can be different. We have the climate that can be different. So we have a couple of other elements that I didn't bring here because I want to isolate the political point of this presentation. But of course, then it's much more complicated and probably beyond my knowledge how to explain exactly how to this gap is appearing or maybe narrowing. But then I don't have an answer. I just can suspect of these other elements that for me, they are two things that they are important as well. I hope I answer your question.
Okay, thanks.
All right, so please, you can raise your hand to ask your question, or you can also type your question in the chat, whatever you prefer, and you can either speak it up or type it. So are there any other questions? Renata is asking, do you think the fact that states are acting against federal judgment is due to lack of coordination from the federal government?
Yeah, we have two main reasons. First of all, of course, because Bolsonaro, he tried to like undermine the disease since the beginning. So like some people that want to take action before, they had to do this by themselves. São Paulo, the biggest state, closed in March, so they just did by themselves. So this is one reason, because the omission of the federal government. And of course, we still have this lack of coordination. People that says that we have to have a more comprehensible federal plan, they should show us what was this plan, because we didn't see any plan. It seems that there wasn't a plan. But of course, the Minister of Health tried to present some ideas, and in fact, some states were eager to act by themselves. Normally, I think this is a good idea, because local governments understand better their own situation, their features, and we have like this huge country with different features, different populations, different structures of hospital health. So I think it's normally a good idea. But of course, maybe a mixed strategy with a federal plan and local governments being empowered to act by themselves would be the best answer to this question. But how to do that? Coordination and then institutions. But as we just don't have this right now, this is exactly maybe my point. Thanks for the opportunity to explain more this point, Renata.
Yes, so I wanted to say, first of all, thank you so much for this great lecture, Jean. I think that's a very interesting analysis of a relationship between the governmental institutions and the trust in them, and the spread of the virus, the amount of cases. And I just wanted for a moment to take our attention to a very particular area of Brazil, which is the Amazon, and ask you about how that spread was happening there. What were the factors? What is the morbidity? Tell us a little bit more about the situation in this area. And then we have two more questions from the public, which are in the chat, and I'll read after you answer my question.
Good that I was ready for that, Professor, because I imagine that Professor will bring me this topic. Yeah, in fact, we had 3 different decisions in Brazilian Supreme Court, exactly because we didn't have any kind of plan to the indigenous populations, any kind of plan. Then they create a special commission exactly to try to have a different plan to protect them, because they don't have the same immunity. And in fact, so we had in the same time a federal intervention in one state, in the Amazon, at the same moment that we are having this pandemic. And like obviously bringing the disease to the Amazon region. So this is so strange that it shows how Brazil was not ready, despite all the warnings. Like we are acting in a so strange way, like leading these army forces to the Amazon, like white man in the midst of this pandemic, to take contact with indigenous population. After that, after this decision of the Supreme Court, it seems that things are a little better, but of course, we still don't have, to be honest, a plan to deal. We are dealing the same way that we are dealing in all other subjects, trying to find like the line while things are happening. So it just shows that, in fact, we don't have a real plan. And of course, the numbers in these communities where the coronavirus hit were like terrible, just terrible, because these communities are so vulnerable, as like old people in nursery homes. So it's so sad, but and shows that yes, we don't want other peoples, we don't want other nations to tell Brazilians how to deal with Amazon region, but at the same time we need to be maybe a little more attentive to this area if you don't want other people to tell you what to do.
So I have one more hand, and there were 2 questions. Question which is similar to mine about how COVID is affecting indigenous population and what is the government doing. And then Alberto is asking how science played out in Brazil in terms of COVID. Is it discredited or subject to misinformation? And then we have someone with a hand in the air waiting to ask a question as well. Thais.
I hope I had answer, Lucy, I think. And yes, if you send me an email, I can try to translate part of this decision of the Supreme Court. They addressed this point. They really tried to create some kind of differentiated protection to indigenous population. But to be honest with you, in the part of government, we didn't have any real action coordinated and like or I think we are not. If the point, my point is that we are not really ready. Once we knew that the coronavirus was coming, we could have tried to create like more commissions and try to see what we can really do differently than other countries. And now I can try to address Alberto's question that is, of course, a point of a huge controversy here and everywhere. I think we could have used elements of science. The point is, when people in Brazil, at least in Brazil, I don't know exactly in the United States, but when you use the term science, it seems to me that it's a closed, not like a broad concept of science as I would like to see. We have been discussing in our classes about interdisciplinarity, transdisciplinarity, multidisciplinarity. How can we try to find social and like hard science at the same time and social science and try to understand these things like the trust of in the government. I don't think Brazil would be able to address coronavirus the same way as Norway addressed it. Why? Because we don't trust our government as Norway trusts its government. So it's obviously the same plane will work very well in Denmark, but will not work in Brazil. So these kind of things are not considered. So when they discuss science, it seems like medicine and maybe some epidemiology, but I think we need to see beyond that as science. And this discussion, in fact, I don't know if we can see anywhere. But of course, in Brazil, we had some kind of, it's hard to say exactly what was the basis of some government actions. We had a strange speech in the television. Bolsonaro said that he was an athlete, and as this Spartan man, he will not be hit by this disease. It would be just like a flu. And of course, it was just ridiculous as it sounds. And of course, it has impact because it's the moral, is like the how people believe in this was a serious situation. So we had this culture that is important as well. How is the spirit of the population at that moment, the mood of the population at that moment, and how politicians will drive decisions and institutions to fight against something like coronavirus. So in fact, I think in Brazil we had like two groups, like people in favor of science and people that were saying, these guys just don't know anything. But at the same time, even taking this group of pro-science, I would like to see more like what we can really do in Brazil, considering our features, considering our country, and not just epidemiology, but politics and institutions and structure and everything else. So it's a very interesting question, Albert. I don't know if I have like an answer for you. I hope I can at least show how is this framework and of course psychological mindset of Brazil that was driven by this, I think, terrible decisions of the government that led us to these striking numbers.
Thank you, Jean. Thais, you can ask your question.
I had a more or less similar question to the interpretation of science or data, at least. I remember the first Secretary of Health, Mandetta, was very inclined to discuss data and do the follow-up with the population and explain data and what was going on and the actions. I would like to talk about what do you see now, in terms of data being used. How is data being used now? Are they trying to compare like regions that are doing better and understand why they're doing better, or compare cities, maybe how is information being used now to try to address science information, but also like empiric information, like, well, this city is doing something good, what could be it, something like that.
Yeah, good question, Thais. The problem of several countries, I believe, is the idea of one size fits all. This was a terrible way to deal with disease that can hit different countries and different populations so differently as indigenous populations. Obviously, the effect will be much worse in these populations. We needed to have something different prepared. And you say, if you are going to use the army, so we can use, but in a way that to isolate these communities, not to get into these communities exactly in this time. So this is, it should just show how strange our reaction to this virus was. About data, yes, Mandetta was very inclined to use this data, and we, since the beginning, we were very interested. My wife is a physician. We were like always trying to see and find some reason in discussing between us. And of course, like United States, even though the answer is not like that good as well, but at least we have these opportunities to discuss data. All like the days, the specialists were trying to show what was happening. We don't know if this data is trustworthy, but at least we had something to discuss and to maybe criticize and to debate. We just had this with Mandetta, and after that, I didn't see anything. We know that we have like cities being categorized by colors, red or orange or yellow. Yes, we have this. We suspect that it's something about the numbers, but we are not sure about the numbers and how many people have been tested, what kind of people have been tested, you know, and what are the criteria, and especially just not like we cannot trust just this information. The second point is what I just said. I think once you have this information about numbers, how can we act? And then we need much more than that. And then we need more than this data about like epidemiology. So how can we act? How can we react to these numbers? This is the question that governments should be concerned, because in fact we pay them for that. They are very well paid to do this kind of thing, to protect us. In these cases, there is no other reason for all the restrictions of social life. We have all the restrictions of social life. The reason for all these restrictions is because we need to have order. We want to have safety. This is Hobbes, this is Locke, this is Rousseau. Any thinker that you can take, you will see this kind of answer. You know, we need to live in society. It seems that it's much better for us. So let's have order. When the government show us that they are not at all prepared to provide us order, I think we have something much more complex to discuss after coronavirus. It's like, what can we do with our governments, especially in governments like Brazilian one, United States one?
Well, there is a question that is a follow-up to what you, Jean, just said. Renata says, when you say we need equilibrium, I did not get if you believe Brazil's institutions are being too flexible or solid. What is your view on this?
This is an amazing question. I think I would like to, I don't know if I'm deviating off your point. I hope not. And if I am, you can let me know. I think in talking about change, structural change, like let's change Brazil. We are too solid because we have this system that it's hard to change, because we have this small group that in fact we know that they ruled government, this huge business, and it's so hard for us to be able to have some influence in government. And so it's obvious that Brazil is hard to change. Like we are struggling to find a way to have a democracy in the political sense of the word, not just in like I'm going to vote, but a substantial democracy. So in this point, how to deal with these political and economic forces, it's hard to change Brazil. It seems very hard. They are always protected, and doesn't matter who is in the government. So this sounds like striking, but politically, institutionally speaking, I think we are too flexible. Like a country cannot have 7 constitutions in a short period. If you think about how will be our situation in 20 years, nobody can answer this question. Nobody can answer these questions about 10 years from now. How will be Brazil in 10 years? We don't know. As both candidates were talking about like drastic constitutional reform. What kind of constitutional reform? Like, we don't know. Haddad probably had something in mind, and Bolsonaro had exactly the opposite in his mind. So, in fact, we don't know what will happen in 10 years. So, in this sense, it's hard to have investment. It's hard to have a country when you can trust the future. So in this sense, I think Brazil is too flexible. And for example, right now in the midst of this crisis, people are discussing the arrangement, the government. Let's have maybe a parliamentarist amidst the crisis. You want to change now the system? So it sounds like crazy, because in 1993 we had a popular consultation to see if you wanted a presidentialism or not. So I think in this sense, Brazil is too flexible. Maybe we should be able to trust better our institutions. We know that we have this framework, we have the answers inside the institutions. If we are not happy with the government, the actions, we should have how to appeal and to influence government, but not like trying to change all the time. So I think it's kind of a double answer. I hope I was able to make it clear.
Mike Goodman is asking also, is the problem of lack of testing as serious in Brazil as it is still in the US?
Yeah, I think worse, but I'm not sure if after the disease had spread, if testing is like really efficient way to track the disease and to try to know exactly what we are. I think it's more important rather than the number of cases, who we are testing and like what population, and to have clear criteria. So we can have smaller samples, like statistics will show us that we can have smaller samples since we don't have bias. This is probably the point, and I'm not sure. And the second thing is that we are completely, if you look Brazilian numbers, it's incredible. Some days they have like thousands of tests, and in the other day no tests, and the other day thousands of tests, and the other no tests. So we cannot really have a line, even a 7 days line, to see if you are improving or are going like down. So with this data, in fact, we cannot do that much, you know. So I think the problem is not the number of tests, we have selection bias to see who we are testing, and especially we need to have like consistency. This again, coordination.
Jean, I'm wondering now. We did a lot of criticism of what is happening in Brazil. I wonder if you are familiar with a group of people or an institution that impressed you in terms of their thought about how to deal with the crisis and how to reconstruct the strategies for future, how to live with that virus, which obviously, as we all know, is not going away tomorrow. Is there some thought that that could be described here as an inspiration for ourselves for the dark spring and summer, dark winter and spring, hopefully not summer, that awaits us?
Yeah, I think I have two things in my mind. One of these things was the University of São Paulo. They tried to use data to really show the situation in Brazil, and to try to compare not just epidemiological data, but other aspects of Brazilian life in culture, and to try to define exactly how we could tackle the virus in different regions of the country. Exactly what we need, but of course they were not heard. This is something that really sounds that will be the right answer. How can we tackle the disease in north of the country, in northeast of the country, in São Paulo, and the south of the country? And second thing, I had the opportunity to pass through Canada before coming to the United States, and we saw things like they were trying to create different lines and shoppings, regulate the number of people. They had some very creative ways to like keep things working differently. We have to find now alternative ways to do the same thing, because it seems that the virus is not going anywhere soon. So as a vaccine is still something uncertain, and I don't think we should rush with something important as a vaccine that can have serious side effects. I don't see this virus going anywhere in like the next time. So we need to find some ways. I think University of Wisconsin was a good example. We had an outbreak inside university. They were able to control in 2 weeks, and it seems that we are doing better now. So I think these kind of things give me some hope that maybe we can find ways to live until we find some definitive answer. So I think I always have hope in the human being's capacity, and the point is we need to have it. If we trust that we always have to have the right person, the right place to take the right decision, I think this is like too much. Maybe we should like really draw better institutions that are able to hear plural voices, and maybe we have like a higher chance to find the right answer. So I think we need to trust human beings in this sense, but distrusting them. And so because of this, that we need political and these institutions to try to find these ways to now deal with coronavirus, but we don't know what is coming tomorrow. This is the point. What is coming tomorrow? Yeah, maybe we could have a worse disease because thanks God, coronavirus has a small rate of death. It's not that serious in this sense, but imagine something like the Black Plague. What would we do if we have a disease that was killing half of population, half of the infected? Then that would be just terrible. So we need to be ready for things like that. This is my concern, and in some point we have some hope seeing how some people are dealing with coronavirus. Let's see what the future is reserving for us.
Yeah, you were going to say something optimistic at the end, and you mentioned that possibility of a virus killing half of the population.
Very good.
Well, hopefully we'll think otherwise. And are there any other last-minute questions? Alberto is having one more question. How hard has it been, or is it estimated to be, the economic impact of COVID in Brazil? Has the federal government in Brazil provided a significant stimulus for the economy?
Yeah, this is probably the question that I have a limited knowledge about any other thing that is not law and something in economic. And of course, my concern right now is what I could try to help in some way. So I'm studying this institutional framework, and of course, trying to see what about the economic impacts. The problem with Brazil, I think, is this common in Latin America is probably we have informal economy that is bigger than 40% of the economy. So 40% of people or more, like in fact, are in this informal economy. And the government now is like providing people with 600 reais a month, is like $100 a month. So obviously this is not enough. And because of this, people are kind of forced to work. And because of this, we cannot contain the virus because people will work anyway, and then they will be infected. And so, of course, this picture helps us to understand why we have this striking number. Yes, because we don't support people with enough. The second question is that if Brazil will have enough money, and this is another interesting question because probably not. We were not in a good economic moment before the coronavirus. So this is terrible. How can we now deal with coronavirus? And the third question that is very interesting is that even though we are spending all this money, and how about the future? We want to have like decision in the future. We have been discussing in our classes the growth or how to protect the environment. And to do that, we kind of know that we need to do something with our economic activity that maybe is to reduce. But how can we reduce now if we have this huge deficit with huge imbalance in fiscal policies? Now it's a third challenge for the future. So I'm very interested in how will be Brazilian budget after this period in 2 or 3 years, and how Brazil will deal with this imbalance. It is a very interesting question. So yeah, not enough, absolutely not enough, Alberto. And even though it's like a lot, and so it's a lot of money. So how to deal with the future challenges? It's like, it seems, I try to be positive, but it's hard considering the facts.
Well, everybody here is writing. Thank you for the greatest talk. We really enjoyed it. We learned a lot. Thank you so much and congratulations. And I think that we should say see you next week. Thank you, Jean.